Betapharm was a German company, and Betapharm had excellent distribution networks. Betapharm had complementary products, products in therapeutic areas that Dr. Reddy's were weak, and Dr. Reddy's had products where Betapharm were weak. And Dr. Reddy's acquisition of Betapharm provided Dr. Reddy's entry into a very, very lucrative German market. The prices in Germany was extremely high for comparable drugs across other markets. An extremely high priced market, and Dr. Reddy's got access to Betapharm. Even though there were other bidders who were wanting to buy Betapharm, in the bidding process, Dr. Reddy's was preferred because of this complementarity of product lines. There were others who were willing to pay more to acquire Betapharm, but the Betapharm owners found that complementarities were very high between DRL products and Betapharm products, and therefore Betapharm was acquired by DRL. They've been able to, post acquisition, DRL have been able to introduce their products in German markets. They've been able to bring in some products of Betapharm into the Indian market, and there've been huge transfer of learning that's happening between Betapharm and Dr. Reddy. Another very interesting case of internationalization is Ranbaxy's acquisition of a company called Therapia SA. Therapia SA is a Romanian company, and it's a very interesting logic that you would expect the Indian companies to be low cost, be more efficient, have very high process efficiency. Here was Ranbaxy acquiring a Romanian company, which was again low cost manufacturing, again process efficient, but Therapia provided Ranbaxy with a toehold into Eastern Europe, and Eastern Europe was a very, very underserved market. Therapia is a company that's not very far from Western Europe, has access to Western European markets, has set up distribution networks in Western European markets, but low cost distribution in Romania. So post the collapse of USSR, the entire Russia and southern CIS countries, Central Asia, Eastern Europe, and Western Europe could be served out of Therapia's Romania facility. So you can find a variety of acquisitions where companies have gone and acquired firms in Ireland rather than in England. Ireland provides a great opportunity because the local laws in Ireland are very different from England. Ireland is not too far away from England in terms of geographic proximity. You could distribute from Ireland into England and still save on labor costs because Ireland was far cheaper in labor than England was. The Indian market is again post 2005 characterized by, like I talked about in the beginning, characterized by two different unique features. One is the great opportunity. The great Indian opportunity extends to diseases. India is the diabetic capital of the world. India has more diabetes than anywhere else, both the diagnosed and undiagnosed. India has a huge number of cardiovascular patients. India has a huge number of arthritis. And these chronic diseases provide pharma majors, who have spent a lot of time and effort in developing new drugs with great opportunity. Chronic diseases provide continuous opportunities to sell drugs. Somebody who is diagnosed with diabetes will continue taking insulin for the rest of his life. That's like you have locked in a customer for life. Cardiovascular, ditto with arthritis. Diseases that cannot be cured, diseases that have to be managed. Now these provide great opportunities for branded drugs to sell in India, which was not true before the product patents were introduced. Post product patent expiry, these pharma majors could come into India and sell these drugs. The way the pharma majors have come into India, a lot of them have done foreign direct investments in really high value life saving drugs like say cholesterol buster, those kinds of drugs. The costs are very high. It doesn't require a manufacturing facility here. You create globally distributed economic scale manufacturing facilities and just import into India. All you need is a good distribution, which you don't need to depend on any local partner to do the distribution network. You just set up a distribution network by which you can also sell your other drugs, but by which you can also sell your high value life-saving drugs. The medium range or medium value drugs for the chronic diseases is where the foreign companies have had to set up facilities in India. Set up manufacturing facilities in India to reduce costs, because a chronic patient is going to look at total cost of treatment rather than just single drug price. As he's going to look at total cost of treatment, you need to really provide or deliver drugs to him or her at very, very reasonable prices. Therefore, they've had to set up facilities in India, either through joint ventures or through acquisition of manufacturing capacities. And in any case, we saw that Indian companies who could not acquire capabilities to do research and development were closing shop. And there were a lot of these plants which are available, manufacturing facilities available for these pharma majors to come in and acquire. So they came in either through just distribution offices, distribution setups, through joint ventures with Indian companies, or through buying facilities, capacities, and expanding capacities in the Indian market.